Hello, and welcome to Dr. B Talks About Tinnitus. I'm Dr. John Burgoyne, and I'm a practicing otolaryngologist, head and neck surgeon in Austin, Texas. I have over 30 years experience dealing with ear, nose, and throat problems and talking to ear, nose, and throat patients. Today we're going to talk about ringing in the ears or tinnitus, and this is for you if you have ringing in the ears or if you wonder what tinnitus means or how it all comes about. So, the first question, why do my ears ring and what the heck is tinnitus? It's actually very simple. Tinnitus simply means noise in the ear. That noise can be high-pitched, it can be low-pitched, it can be roaring, it can be whistling, it can be whooshing. All of those are tinnitus. Sometimes a patient will come in and say to me, "Doctor, I'm concerned that I have tinnitus." I say, "Okay, do you have noise in your ear?" "Well, yes." And it's pretty easy. I say, "Yeah, well, you've got tinnitus." It's not a diagnosis. It's a symptom, just like headache is a symptom. It's also super common. Studies show that up to 43% of adults have tinnitus. And that sounds like a lot. And it gets even worse because over half of people my age, over half of seniors, have tinnitus, at least some of the time. 2 to 5% of people, even in their 20s, have tinnitus. And although the vast majority of these people are kind of mild to minimally annoyed by the whole process, there's a few people for whom it's extremely disruptive and can really mess them up. There are two main kinds of tinnitus. The first one is what it would say is a perceived noise. There's no actual noise going on. It's something that is generated in our heads somehow. And that's the tinnitus we're going to be talking about today. The other type is a pulsatile tinnitus. That's a whole different talk. But so for today, we're going to talk about the perception of a noise in one or both ears, but that's in the head. So let's think for just a minute. When you hear sound, it comes in your ear, vibrates your eardrum, moves these little bones, and then it's picked up here in this snail shell looking thing, which is called snail shell, cochlea, which just means snail shell, then goes along this nerve into the brain and finally ends up in this part of the brain in the temporal lobe, which is where we perceive it. That whole system is made to get the most out of sound. So there is processing, and for a lot of the time, what that really means is amplification. So when the brain has to amplify things too much, noise gets into the system, and we call that tinnitus. So I'm going to give you take you on a little journey with me. Here we are. This is beautiful Austin, Texas. And let's say that we've decided that we're going to drive from Austin west forever. And sadly enough, our phone's music player is broken. So we're going to have to listen to the radio. All right, well, let's say there's a nice little AM station broadcasting here in Austin, and here we are taking off. And when we're close to the radio station, we don't have to turn the volume up very high. And it's nice, clear signal, not much static, everything goes great. I tell you, by the time we get over here by El Paso, the signal is so weak you can barely hear it, so you have to crank the volume up, and there's all sorts of hissing and static in the sound. It's exactly the same with tinnitus. When hearing drops off for whatever reason, our amplification systems in our ears, in the neural pathways, and in our brains ramp up, and that causes there to be noise. And we perceive that as tinnitus. And that's what it comes from. It's not that there's something wrong with your brain. Your brain is doing what it's supposed to do, which is maximize sound. It's that your hearing has dropped off. So, interesting things about that. If you're in an area where there's very little environmental noise, so like if you're in your bedroom and you're trying to go to sleep, your tinnitus will sound very loud. Your brain's getting very little input from the outside world. It thinks it's missing out, and it cranks up that amplification system. On the other hand, if you're in some place where it's noisy, or if you make it noisy, like putting a a fan in your bedroom or something like that, the brain doesn't ramp up the signal as much, and the tinnitus will be less. It's not just that this noise is overwhelming your tinnitus, it's that you actually have less tinnitus, and this has been shown experimentally. The way they did that is they get somebody with tinnitus, they put them in an ultra quiet room and rate the tinnitus, and then they put them in a noisy environment, rate the tinnitus again, and then they turn off the noise. Well, eventually it takes about 20 minutes for the tinnitus to get back up to its usual silent amount. And that's because, unlike a guitar amplifier, which you turn the knob and you're suddenly cranked up, all these processes in the brain are electrochemical, and they take a few minutes to get there. Most tinnitus then is caused by hearing loss. And most hearing loss in our society is due to either your genes or most commonly to noise exposure. That can be, fireworks, guns. Well, maybe not a squirt gun, but guns. I'm going to be a non-violent thing here. Aircraft noise is very loud. Music, that's my generation. Lots of loud music, but even any kind of music will do it to you. But loud noise over time decreases our hearing, mostly in the high tones, and that's why most people have high-pitched tinnitus. Okay, so we know that the tinnitus is coming from hearing loss, and it's not that the brain is broken, is that the brain is doing its best. Got to give our brain some love here. So what can we do about it? Well, first thing is you want to get a hearing test, because we maybe want to know something about this hearing loss that you have. And second thing, of course, is to protect your ears from further damage, and that's very helpful as far as the future goes. But to make it less bothersome, avoid complete silence. I tell people to put a fan in their bedroom or have their phone do a white noise generator or something like that, because it turns out that our brains will then turn down the tinnitus, and our consciousness is much happier with noise that's outside our heads than noise that's inside our heads. There's some drugs that'll make tinnitus worse. Aspirin is famous for this. Things like ibuprofen can also do it. Caffeine will make tinnitus worse for a lot of people, as will most other kind of upper type medications. And that's kind of all you can do to really try to turn it down. Most people, it stops bothering them after a while. If I see a patient with tinnitus that's recently bothering them, and I see that patient again a year later, I say, hey, how's your tinnitus? And they'll say, oh, well, I guess it's still there. It doesn't bother me anymore. And that's most people's experience with it. That's my own experience with it. I have really loud tinnitus in this left ear. It usually only bothers me, or is very noticeable, when I'm talking to people about tinnitus, which, of course, for me is several times a day. If you're one of those small percentage that it's really disruptive and it's really making it hard for you to cope, the most useful thing to do is cognitive behavioral therapy. This is basically a method to have a therapist, these would be licensed psychologists or other licensed individuals, who will teach you how to put that noise in the I'm ignoring it box. And it's very effective and is certainly the most effective thing that people can do. So that's tinnitus. Tinnitus is the response of our brain and nervous system to less noise, less sound than it's expecting to hear. It's not because there's something wrong with you. It's that well, there is something wrong with you. You have a hearing loss, but it's not that there's something wrong with your brain. It's that it's trying to compensate for that. I said we should get a hearing test because if there's something about your hearing test that raises a red flag for something else, it's important for your doctor to follow up on that. It's particularly important to go get a hearing test if you notice that you have ringing only on one side, or that you suddenly have ringing that you've never had before. You need to check those things out to make sure that nothing's going on that you need to see your doctor about. But for the vast majority of people, it's a completely non-worrisome thing. almost never means you have something terrible going on in your head. So you need to be relaxed about that. Thank you for listening. This has been Dr. B Talks About Tinnitus. Remember, Dr. B Talks About is presented for informational and entertainment purposes. It's not designed to diagnose or treat any medical condition. If you have concerns about your health, make sure and see a doctor. Online forums, YouTube, even Dr. B Talks About, is not the practice of medicine. You'd think I wouldn't need to say this, but you'd be surprised how many people come in saying, I saw this on YouTube, so I know what I've got. That's not how it works. So go see a doctor. If you're in the Austin area and you want to come see me, I'll be happy to see you. John Burgoyne, Google me, you can find me. And if you enjoyed this video, please make sure to hit the like button, hit the subscribe button, check out our other offerings, and share it with any of your friends who you think might find this to be useful. Thank you.